ambapo tunakujuza yanayojiri katika sehemu mbalimbali humo nchini. Jina langu ni Andrin Kilemi. Moja kwa moja tuanze na taarifa ambapo gavana wa Migori Okoth Obado wakiwemo na washukiwa wengine pamoja na wanawe 4 wako katika koti ya Milimani hapa jijini Nairobi, ambapo kesi yao inatarajiwa kusikizwa leo asubuhi na Jaji Lawrence Mugambi. Kumbuka mtazamaji, gavana Obado anakabidhiwa na mashtaka ya ubadhirifu wa fedha, wakiwemo na washukiwa wengine pamoja na wanawe 4. Mwanahabari wetu Nanok Lauren yuko pale anafuatilia taarifa hiyo kwa kina. Iwapo tutapata picha za moja kwa moja kutoka kwenye mahakama ya Milimani, mtazamaji, tavuka pale tuweze kusikia yanayoendelea kule.
Kama ya Milimani ukisubiri kesi ya gavana wa Migori Okoth Obado kung'oa nanga, na tunasubiri kutoka dakika chache kuanzia sasa. Kesi hii ni kuhusu ombi la kuachiliwa kwa dhamana kwa gavana Okoth Obado pamoja na wanawe 4 na washukiwa wengine kuhusu ubadhirifu wa shilingi milioni 73.4. Hapo weekend Ijumaa iliyopita Jaji Lawrence Mugambi aliwaamuru wasalie rumande wikendi hii, na ifikapo Jumatatu basi ombi hilo litasikizwa na watajua kama wataachiliwa kwa dhamana au vipi kesi hiyo itaendelea. Lakini kwa sasa tunasubiri kesi hii ianze toka dakika chache kuanzia sasa. Gavana Obado anahutumiwa ama kabili kesi hii kwa madai ya ubadhirifu wa shilingi milioni 73.4 kutoka kaunti ya Migori, akiwemo watoto wanawe 4 pamoja na washukiwa wakiwa watu 7 hivi. Basi tunasubiri kesi hii kuanza asubuhi hii leo, na kuanzia sasa nitakuwa natoa taarifa kemkem kuhusu ombi hili la kuachiliwa kwa dhamana. Kwako Andrin.
Naam, shukrani sana mwanahabari wetu Nanok Lauren kwa taarifa hiyo. Mtazamaji, ni taarifa ambayo anafuatilia kuhusu gavana wa Migori Okoth Obado, washukiwa wengine pamoja na wanawe 4 ambao wanakabiliwa na mashtaka ya ubadhirifu wa fedha. Mtazamaji, ni kesi ambayo itakuwa inasikizwa asubuhi ya leo na Jaji Lawrence Mugambi, kama alivyotueleza mwanahabari wetu Nanok Lauren. Tutakuwa tunapata taarifa hiyo kwa kina baadaye. Tukisonga mbele ni kwamba mbunge wa Malindi Aisha Jumwa alikamatwa jana baada ya kujisalimisha katika kituo cha polisi cha Port. Jumwa anatarajiwa kufikishwa mahakamani leo kwa madai ya ufujaji wa zaidi ya shilingi milioni 19 za hazina ya maendeleo ya eneo bunge hilo.
Nimetoka asubuhi nyumbani. Nimefika Port Police. Nimemalizana na yale alikuwa pale. Sasa I'm heading home. Tulikuwa tunajitayarisha na mambo ya kesho, kwa sababu kila mtu anajua kwamba mimi kesho ama koti ilitoa directives za kwamba kesho nitokelezee kotini. Kwa hivyo tulikuwa tumekuja kupanga, taratibu zote zimefuatwa. We are ready for tomorrow. Nafikiri zote kesho tutakuwa kotini na mtasikia mashtaka yatakaposomwa, yale ambao natuhumiwa kwa nimefanya. Kwa hivyo hilo nafikiri si jukumu langu kusema makosa gani nimefanya. Kesho sisi wote tutakuwa pale, mashtaka yatasomwa, then tuendelee. Kwa hivyo mimi nimeingia jana usiku na nimefika mahali nilipokuwa natakikana kufika, ambao ni Port Police, na tumemaliza, tunangoja kesho sasa.
Na mtazamaji, inaelezwa kwamba mbunge huyo tayari amefikishwa mahakamani, kwa hivyo tutakuwa tunasubiri hatma ya uamuzi ambao jaji atakuwa anapeana. Mtazamaji, ni kwamba mbunge huyo Aisha Jumwa tayari amefikishwa mahakamani. Ni taarifa ambayo tutakuwa tunakuletea kwa kina mwendo wa saa 6 na saa 7 mtawalia. Kwingineko ni kwamba mzozo wa uongozi unaotokota katika kanisa la Kakamega Pentecostal Assemblies of God, huku waumini wakigawanyika kuhusiana na uhamisho wa mchungaji wa kanisa hilo. Kundi moja linalomtaka mchungaji huyo kuondoka, likiongozwa na karani wa kanisa hilo Dan Osore, limesema kuwa mchungaji huyo amekuwa akitenda mambo kinyume na mwongozo wa kanisa hili, hata kwenda kinyume na maamuzi ya afisi kuu. Kulingana na karani huyo, mchungaji huyo kwa jina Alfred Magoya, baada ya kupata barua ya uhamisho, amedinda na hata kufanya uchaguzi kujichagulia afisi ya watu kadhaa ambao wanamkinga kutetea maslahi ya binafsi kwenye kanisa hilo, na sasa wanangojea uamuzi utakaochukuliwa na afisi kuu.
Mchungaji katika mojawapo ya makanisa yetu alipewa transfer ondoke, lakini akakatalia kwa sababu ya hoja zake, na hiyo kitendo hakikuwa kizuri. Lakini tumezungumza na wazee wa kanisa, tumekaa chini, tumezungumza na tumekubaliana tutarudi, na bado yule mchungaji ataondoka kwa sababu tunataka amani. Tunataka kanisa iwe na amani. Na vile tu nilisema, kanisa ikiwa na amani, nchi itakuwa na amani. Tunahubiri amani, tunahubiri umoja. Kwa hivyo hatuhitaji utofauti. Kwa hivyo nashutumu kitendo hicho cha kuzuia na kuleta taharuki. Sisi tunaomba tu amani na utulivu.
Tulipeleka kesi kotini ili kesi iamue ya kwamba kwa nini hakukubali kwenda transfer. Kwa sababu hata mimi nilifanya kwa organization na kwa serikali, na ninajua kwamba ukipigwa transfer unaenda transfer. Kama kuna malalamishi unakuja kulalamika baadaye.
Kanisa limetekwa nyara na watu mikora, wamedivert kanisa, wamepeleka kwa kitu ambayo inaitwa caretaker, ambao ni kitu yenye haina mwelekeo. That's why wako na chuki, hawataki kuona hata Mr. Dan Osore ambaye ni secretary, kwa maana wanajua ya kwamba yeye ndio wako na documents za hiyo kanisa, na yeye ndio wako na records zote ambazo zinasema ukweli wa hiyo kanisa.
Mtazamaji, mkutano wa serikali ya kitaifa na zile za kaunti kuhusiana na maambukizi ya corona nchini unaendelea kwa sasa. Mkutano huo kwa njia ya mtandao unajadili hatua zilizochukuliwa kufikia sasa kudhibiti ugonjwa huo nchini. Hebu tusikilize mkutano huo unaoendelea kwa sasa.
It's a pleasure to join you today on behalf of UNDP to give some remarks in this important and timely virtual conference as we reflect on the impact and the response to the COVID-19 pandemic in Kenya to build resilience. Let me also express my sincere condolences to all those that have lost family and loved ones in the fight against COVID-19. For the first time since 1990, global human development is on track to decline this year due to COVID-19. This is happening in the same year that marked the beginning of a decade of action towards the Sustainable Development Goals. As evidenced across the world and here in Kenya, COVID-19 has fundamentally changed the context of development. And what we face today is, as you have repeatedly called it, Your Excellency, indeed a war. COVID-19 has amplified the long-standing structural deficiencies in health systems impacting on the most vulnerable. Drawing on UNDP's global experiences with other outbreaks such as Ebola, HIV, SARS, TB, and malaria, we are helping countries to respond to COVID-19. Working with governments at the highest level, we are helping to mobilize resources and support the development of national systems for strengthening transparency and accountability in the response to this pandemic. For example, recently in Nigeria, UNDP supported the COVID-19 Presidential Committee to set up a resource tracking dashboard to ensure greater transparency in the use of public financing for the COVID-19 response. In Kenya, working within the wider UN family under the leadership of our resident coordinator, UNDP is accompanying the government and the people of Kenya in efforts towards eradicating poverty, reducing inequalities, and building resilience to crises and shocks. On COVID-19, we are responding to the demands of our partners at both national and subnational levels, including ministries, the Council of Governors, county governments, the County Assemblies Forum, civil society organizations, and we are engaging the private sector on initiatives that aim to prepare, respond, and recover from COVID-19. This assistance is by no means exhaustive, but has included the following: providing frontline health workers in hospitals and medical facilities to counties most in need through our joint UN devolution program, supplying PPEs across various institutions, providing medical waste disposal equipment to some 13 health facilities, developing and communicating factual COVID-19 to Kenyan citizens in local languages, promoting innovative digital solutions, working with youth in the areas of health, food security, and dignified work, enhancing business continuity of government through also digital solutions. We are also collaborating with civil society organizations to protect human rights, promote gender equality, and access to justice. We are working with the peace architecture in the country to mitigate potential conflict that could derail progress towards the SDGs. In the area of socioeconomic recovery, we are supporting the National Socioeconomic Recovery Strategy, which is linked to Vision 2030, the Big Four Agenda, MTP3, and of course, the Sustainable Development Goals. We are conducting socioeconomic research to inform county-level recovery strategies and integration into the CIDPs, including financing instruments for their implementation. We have developed a series of policy briefs on the impacts of the pandemic and are currently technically leading the UN's socioeconomic response aimed at saving lives, protecting people, and rebuilding better. Your Excellency, we have an opportunity to build forward better and greener, to restore balance between people and planet, designing and de-risking nature-based solutions as part of a new social contract for the world. Kenya, I am confident, can emerge stronger from this crisis with more robust, transparent, and accountable institutions in all sectors. UNDP stands ready to continue supporting your government and the people of Kenya. We have, I believe, the collective expertise and the experience to look beyond recovery and towards 2030 together. Your Excellency, ladies and gentlemen, let us be reminded that the young people of this great country are its greatest asset as leaders, as change agents, and as innovators. We must make sure that we prioritize solutions that put youth at the center of everything we do, with them and for them, as we recover from this crisis. We commit to leveraging and working under the GenU platform that Your Excellency launched earlier this month, and for which you are a global youth champion. As I conclude, let me summarize 4 key messages. While I wish to congratulate the government of Kenya for putting in place robust COVID-19 management strategies that we have heard about earlier, and these have been critical in containing the spread of the virus and minimizing losses, both economic and human, we cannot be complacent. We must keep our foot on the pedal. 2, as the world seeks to build forward better, we must ensure that the SDGs and its core principle of leaving no one behind, particularly our youth and women, remain our compass in devising our recovery strategies. 3, let us be reminded that this is a moment for all humanity to rise above business as usual and deliver the most efficient response possible with the highest standards of integrity. Together, we will win this war, but only if we seize the opportunity to unite against a common enemy armed with the right strategy as we learn from the lessons of others. In closing, I wish to acknowledge and thank the government of Kenya, our bilateral and multilateral development partners that continue to stand with the government and people of Kenya in responding to the COVID-19 pandemic, and who have entrusted UNDP to serve as an implementing partner for many of their programs. Specifically, I want to thank the government of Japan through the Ambassador, His Excellency Hiroishi Hori, for enabling UNDP to support this important conference, as well as other COVID-19 response and recovery measures being implemented through us. We will continue to fight this pandemic and stand with you solidly. I wish this conference every success. Asanteni.
Thank you very much, Badawi. And now it is my honor and pleasure to invite our Chairperson, Council of Governors, Governor Wycliffe Ambetsa Oparanya, who will make his remarks, and then he will proceed to invite our President. I had wanted to do that, but it is an honor reserved for our Chair, and our Chair will introduce our President. Oparanya.
Yeah. Your Excellency, Honorable Uhuru Kenyatta, the President of the Republic of Kenya, His Excellency Dr. William Ruto, the Deputy President of the Republic of Kenya, Excellency Governors and Deputy Governors, Cabinet Secretaries present, High Commissioners and Ambassadors, representatives of the national and county governments, development partners, private sector, international guests, fellow Kenyans. On behalf of the Council of Governors, I take this opportunity to extend my most sincere gratitude, first and foremost, to the President of the Republic of Kenya, His Excellency Uhuru Kenyatta, and to each and every one of you for honoring our invite and choosing to participate in this virtual conference. For the past 6 months, Kenya has been among the many countries of the world that is managing the COVID-19 pandemic. This virtual gathering today will provide us with a platform to collectively reflect on government's action in the prevention and control of COVID-19, discuss the impact of the disease that has had in our nation's socio-economic space, and recommend strategic and sustainable interventions that can be adopted by both levels of government for this and for the future pandemics. Allow me, Your Excellency, to convey appreciation to you for the effort to bring the national and county government together with a view to forging coordinated national response to COVID-19. Thus far, we have held 3 extraordinary summit meetings, which have allowed the 2 levels of government to galvanize collaborative measures in the fight against COVID-19. Fellow Kenyans, more positive cases continue to be recorded every day. More deaths keep being reported. The nation continues to witness more despair and hopelessness owed to the closure of businesses, low incomes, and loss of livelihood. Tourism, a bedrock of the Kenyan economy, has taken a huge blow from both domestic and international restriction of movement. Value chains that guarantees production and sale of agricultural products have nearly been paralyzed. Despite all this, we remain a resilient nation in the doom, let us be hopeful for a better future. COVID-19 has forced us to look forward, to look inward, and create a solution for ourselves. As much as the pandemic has shaken our systems, some good has come out of it. For example, Kitui County is now producing masks and personal protective equipment, PPEs. We have seen universities develop ventilators. Young people are producing locally made sanitizers and assembling ICU beds. Our working together has enabled us to achieve a lot towards the fight against COVID-19. Fellow Kenyans, COVID-19 has exposed the gaps and weaknesses that exist in our socio-economic systems and structures. The onus is on us, the national and county government, development partners, private sector, and civil society to devise remedial measures that will ensure every Kenyan's right to health care, food, shelter, and housing is guaranteed. Moving forward, we must act differently. That is why the Council of Governors commissioned the development of the county post-COVID recovery and reengineering strategy, a plan that will assist the sub-national level to adopt measures that enable it to prepare, respond, and recover from the future pandemic. Ladies and gentlemen, the Council wishes to thank our partners who have made it possible to have this conference. Specifically, a heartfelt thank you to the United Nations Development Program through the Japan government, the World Bank, and the County Pension Fund for supporting this conference. And to the Council Secretariat, thank you. Distinguished guests, I wish you a fruitful celebration during this conference. Ladies and gentlemen, I now welcome His Excellency, the President of the Republic of Kenya, His Excellency Uhuru Kenyatta, to officially open this conference. Asanteni sana.
Thank you very much, and let me begin. Chair, Council of Governors, Governor Wycliffe Oparanya, all county governors, our dear friend from Japan, His Excellency Roichi Horie, the Secretary General of UCLGA, Pierre Mbazi, the UNDP Resident Representative, Walid Badawi, representative of various development partners, and all our distinguished guests, ladies and gentlemen. Let me once again say that it is with great pleasure that I open this virtual conference. And indeed, as I said earlier, I am particularly pleased that today's assembly is a congregation of solution givers and problem solvers. But let me also at the onset join all of you in once again extending my condolences to all those who have lost loved ones to this pandemic. Ladies and gentlemen, this conference brings together a multidisciplinary community of problem solvers, leaders, and a group of professionals and policy practitioners who have applied their minds to the COVID-19 pandemic for the last 6 months. I commend today, through you, Chair, the Council of Governors for bringing us together. This forum affirms the unique place of county governments in the structure of our governance and towards the realization of our national values, which includes public participation. Today's engagement brings together an assembly of our country's foremost brain trust on COVID-19. Everyone present here has agonized in one way or another in their area of professional practice over how to manage and eventually end this crisis. Many of you have experienced anxiety as you crunch numbers, rationalize models, and contemplate over what should be best or the best decisions for our country. Indeed, on my part as President, I have been called upon to make weighty decisions that presented the most unique dilemma to me as the head of state. More often than not, as I have indicated in my previous statements, the agonizing dilemma was one between two rights. Never before in the history of our nation has the head of state been called upon to invoke the Public Health Act and issue containment measures that would significantly affect the enjoyment of various liberties, rights, and freedoms of our people. And so today we gather here to harvest the results of these collective experiences and together chart a way forward for our nation's future. We are here to collect and build on the best practices that we have all recorded in the last 6 months. So today, if you are custodians of best practices in the fight against COVID-19, you must remember that best practice is never implemented retrospectively. It must be applied instantaneously. Timely and instantaneous implementation of what has worked is what will take us forward and most significantly secure the gains that we continue to make. But as we implement best practice after counsel of this conference, our shared goal must also remain in sight. And this goal is simple: victory over COVID-19 and nothing else. And we must achieve it with zero option. And to achieve it, we must begin by building positive resilience. We must move away from tactical response to this pandemic to strategic response. Instead of symptomatic reactions to this crisis, we must move to structural reactions that are long-term and transformative. And this is what I call positive resilience. Being able to anticipate the patterns of this pandemic and responding to it transformatively and building back better. Ladies and gentlemen, allow me now to suggest a framework for banking your experiences of the last 6 months in this conference. This framework has 3 elements. First, I want us all to do a post-mortem analysis of how we have handled the COVID-19 crisis 6 months after it began to manifest itself in our country. Begin by looking at the forecasting of the spread of the virus. If all our models had projected severe scenarios that did not happen, was it because we were forewarned, or was it because of the swift interventions that we put in place? How does our national response compare with others within the region, the continent, and the world? Is there something that we could have done better? And are there lessons we should carry with us to the strategic phase of this war? Ladies and gentlemen, and I am not asking you to ponder these questions because we have failed. To the contrary, I believe we have done remarkably well, and that is why we have begun to flatten the curve. But to do better, we must remain brutally honest with our approaches, because intellectual honesty is critical to building resilience going forward. Ladies and gentlemen, secondly, after doing a post-mortem analysis, I invite you to do some in-mortem analysis. Ladies and gentlemen, we are in the middle of a crisis, as you all know, and we must analyze as it unfolds and changes form. The good news, though, is that in the middle of this crisis, the curve is beginning to flatten. However, we must not celebrate this happy moment too soon, but rather celebrate it with a great deal of caution. More so because the curve begins to flatten after it reaches its highest point. This point is also called the inflection point. And it is the most dangerous point because the curve can either flatten and de-escalate or take an upward surge. My appeal to all of you as experts, practitioners, and leaders is therefore to deliberate on our in-mortem condition. Although the curve, as I said, is beginning to flatten, could it surprise us by taking an upward surge at this inflection point? My third invitation to you, ladies and gentlemen, is for you to do a pre-mortem analysis. This is about early warning, but more fundamentally, it is about long-term response. If indeed we are to shift our response from tactical to strategic interventions, we must do a simulation of how this will work. A shift from symptomatic response under COVID-19 to structural response under universal health coverage must be well thought out. How, for instance, will the environment respond to this shift, and what are the enablers and disablers of this undertaking? Pre-mortem analysis will help us chart the path to sustainable health provisioning for all. Using this model, the conference should therefore give us counsel on how to promote preventative medicine over symptomatic care. It should guide us on how to use the lessons learned from the COVID-19 experience in order to anchor the full national rollout of the universal health coverage, one of the pillars of my administration's agenda for the nation. But most importantly, this conference of leaders, experts, and stakeholders should use pre-mortem analysis to guide us on how to build positive resilience out of the COVID experience. We must use this experience and lessons learned to build back better and to create a society capable of absorbing shock and emerging on top. But most critically, a society which unites when called upon to do so in the face of such a monumental challenge. As I conclude, I challenge all of us to reflect on how we can position our country to emerge as a stronger and more responsive state from the current pandemic. And with that, ladies and gentlemen, I want to wish you all very productive deliberations, and more importantly, look forward to your counsel on the steps we could adopt to conquer this invisible enemy going forward. It is now my pleasure to declare this conference officially open. I look forward to participating and to offering some concluding remarks. I thank you all God bless you all, and may God continue to bless the Republic of Kenya. Thank you. Asanteni sana.
Very much, Your Excellency, for that speech and also for opening our conference. But I will request that you stay on briefly, because I know you have a lot of work and you are a busy person. We have a video that is coming up on the COVID-19 county government experiences. So you watch that, it's just 2.5 minutes, and you will be able maybe to release you, and we expect you early afternoon so that you can also close the conference for us. Otherwise, thank you very much. Now.